Good afternoon and welcome to the webinar on automating your outcomes and impact. The IT guy or gal is your friend. I'm Debbie Thompson and I'm president and founder of Strategy Solutions, and I'm delighted to have the opportunity to share some thoughts and insights with you today. If you're one of those people who we meet at the Association for Community Health Improvement conferences and at other workshops and information sessions about community health needs assessments that are struggling with how to really measure outcomes and impact and evaluate your work. Our purpose today is to talk about a number of different things related to, how ready are you to do this? And this webinar is actually a modification of an in-person workshop that I did in the spring of 2016 for the Association of Community Health Improvement. And it was a pre-conference workshop, so it was a 3-hour workshop. And part of that workshop was to complete a self-assessment to determine how equipped you are to automate your outcomes and impact measurements. And as part of the package of materials and resources that you'll get as part of this webinar, that self-assessment is actually a tool. It's a printable document that you can actually do your assessment yourself on how ready you are to automate some of these things. It also gives you the opportunity to identify appropriate and specific outcomes and impact indicators related to the triple aim. We're going to talk a little bit about how to think about those outcome indicators, determine strategies to integrate selected indicators into your existing electronic medical records and information tracking systems, because putting tracking systems on an Excel spreadsheet is not automating them, although I know plenty of nurses and nurse navigators who have tick sheets on their desk to count patients that are involved in a particular process, and then to help you develop an action plan to improve the outcomes and impact measurement in your organization. For those of you who may not be familiar with Strategy Solutions, our company exists with a mission to help create healthy communities. And it started 20 years ago, actually. We're coming up on our 20th anniversary. Out of my work, I call myself a recovering hospital planner. Please don't hold that against me. But I worked in community health improvement in the 90s and really learned that hospitals alone were never going to solve the community health equation. But if we were going to create healthy communities, we were going to support private sector wealth creation. We were going to have strong communities in government and the infrastructure to support private sector companies. And we would have a strong social service sector, which included communities in government and community-based nonprofits that would help people live in a healthy community. And we, in addition to planning and research, which is a lot of our core competencies and a lot of the work that we do also do a lot of work in evaluation. And our planning and evaluation process really includes 5 simple questions. Where are we now? Where do we want to be? How are we going to get there? Who's going to do what? And how are we doing? And what our approach is when we work with clients is we help them assess the gap between where they are today and where they want to be. Sometimes we'll come in as a consultant and fill those gaps through what we call best practice role modeling. But we use a capacity building approach that's a do-teach-coach model, the way we describe it. So we'll come in and we'll do an evaluation for an organization. We'll help set up outcomes measures if we need to. We'll conduct an evaluation process and teach internal staff how to do it, and then get everybody on the same page or align the organization from top to bottom and get everybody working together. Now, many folks recognize that we have the letter of the Community Health Needs Assessment IRS Guidelines, so we have to do our CHNAs every 3 years. We have to evaluate outcomes and impact, and it should be annually with the 990 submission, even though some people interpret those guidelines a little bit differently. But the spirit of the law is really not so much that we just have to do this stuff to be compliant, but it really is about creating a population-based planning and healthcare delivery system to promote prevention and to really achieve the triple aim which is lower healthcare costs, improve quality, and improve outcomes or health status. And with that in mind, we may or may not have a very robust and automated approach to looking at our strategies and outcomes and impact measures. But we start off, and I mentioned that there is a tool that goes along with this webinar that, gives you the opportunity to look at, how equipped are you? But we start off with looking at, what are our strengths and what are the things that we have in place, and then what are our opportunities for improvement? How could we improve our internal capacity to do better measurement? And one of the things that will help us do better measurement and do better evaluation is to remember this: that community health improvement strategies don't necessarily have to be community benefit, but all community benefit strategies should tie to community needs in some way. So we should be thinking about how we connect the dots. And we should also tie our CHNA activities to our strategic planning process, so that the strategic planning process, and every 3 years our needs assessment process, should be the driver on the front end and the evaluator on the back end of whether or not we're doing the things that we should be doing to improve the health of the community. Now, our implementation strategies should encompass our community benefit and prevention strategies, our service line development strategies that are aimed at specific community needs, such as cancer prevention or cancer care, and then our post-acute and continuum of care strategies, as well as readmission strategies, because a lot of those are community health improvement work. They may not be community benefit strategies, but some of them are. And we need to think about how we differentiate that to really measure and evaluate what we're doing in an appropriate way. But the purpose of this webinar is not to talk so much about the theory behind it, but to talk about the nuts and bolts of tracking impact across the continuum of care. Because this population health perspective is about thinking differently about what happens to the patients. One of the things that we've recognized in working with a number of hospital systems is that some hospital systems have pretty well developed they're measuring their prevention strategies. The wellness department or the outreach department is doing all these health fairs and screening programs, and they've got all this data in Excel spreadsheets that aren't connected to what's really happening with the patients, even if they're patients of our physician practices. So we should be thinking about how we connect the dots and keep track of those people across the continuum of care, because the true outcome and impact of our intervention strategies up front are often measured by what happens to people down the road, and how do we really assess that. So I encourage people to really start to think about that across the continuum. Now, if we want to improve our measurement capability and identify those indicators, how do we get started? The first thing we do is to develop logic models. I was actually on the phone today with one of our clients that's doing a number of complementary therapies as part of their cancer program implementation, and their community benefits, they're all free. They offer art therapy and yoga classes and education programs and different kind of support things. And they're all community benefit because they're free. And anyone, not just their cancer patients, but anyone in the community can take advantage of these services. Now, we were talking about, well, how do you measure the impact of art therapy? You start by creating a logic model. And then you look at your outcomes and impact measures. In some cases, you can talk to your IT professionals to create those data collection and reporting systems through existing electronic applications and software. For example, one of the things that our prevention and wellness programs often don't have the ability to do, because they are maybe in the marketing department or in the outreach department, is actually register people and actually put their information in the medical record so it's electronically available. And oftentimes that staff that does that don't have access to the medical records. But why can't we create that? So talk to IT professionals about creating those data collection systems. Develop a progress report so we're actually reporting on it. Another project that my colleague Kathy and I are working on is looking at how do we measure the outcomes of spiritual enrichment programs or even chaplaincy programs in health systems, because the spiritual component and the spiritual well-being is really important, especially to faith-based organizations. Well, how do you measure that? And we have one client that has a lot of data that the chaplains are actually collecting in the medical record, but they have no reporting of that data. So it's there, but it's not getting reported. And then discuss and document the informatics development strategies as part of your CHNA implementation action plan, which is actually kind of a novel strategy. So how do we get started with translating our goals into measurable outcomes? Well, first of all, we should be asking ourselves, what's that intervention program, whatever it is, attempting to accomplish? Are we trying to increase people's knowledge? We were talking today about nutrition programs that bring people in. They have a speaker for education. They provide some cooking demonstrations, give recipes. Those are the activities, and the number of people who come are an output. But the outcome of those activities is, are people actually making things based on that? Are they trying new foods? Are they, over the long run, changing their lifestyle? So a logic model can help you sort of sort out those indicators and look at those conditions. And I really like this slide here because in the short run, you know, we have inputs, the staff, the volunteers, the money, the things we invest. We're doing some type of activity. We're delivering services, or we're doing a screening, or we're training, or we're teaching. We reach participants, clients, customers. In the short term, the participants may have some increased knowledge about the topic that we're training around, whether it be nutrition or diabetes or cancer prevention. They may have awareness. Their attitude may shift based on what we taught them. They may learn a new skill. They may have a difference in the intent to change behavior. Those are all short-term outcomes. Medium-term outcomes are action-related. I changed my behavior. I tried a recipe at home, or I've done some different kind of decision-making, and over the long run, my condition has improved, my health and well-being. And if you think about any program that you're offering, and you think about, well, what are the real outcomes versus the number of people who participate, how do I start to get that data and make it part of what I'm collecting over the long run? Our logic model can tell us, you know, process or output measures, satisfaction, program strengths and weaknesses, the number of people reached. You know, an outcome. What a short-term outcome is, what are the knowledge, attitudes, behaviors that changed as a result of my program? And then the impact are things like, well, what are the long-term enhancements or the quality of life improvements that are a result of the changes in those variables, okay? And then ultimately, how does the program save the system money? So if we are, for example, doing a diabetes management program where we're teaching people good nutrition, we're teaching them how to eat differently, and we're looking at their A1C levels, for example, or their blood sugar levels as an outcome measure, you would expect that over the long run, that would go down, their health status would improve, their well-being would improve. But in the short run, we want to measure things like intent to change behavior and whether or not they're actually doing the things that we've encouraged them to do as part of our tracking of their case. And we should be following people over time. So let's see. Once you've identified, well, I really want to track A1C level as part of my diabetes management, and I want to track, you know, are they actually doing the things that are part of our diabetes education program? What you want to do is you want to outreach, talk to your IT friends, and ask the following question. Does the outcomes data already exist somewhere in our EMR system? Because what happens for a lot of screening programs, which again, on the community benefit side, people struggle with outcomes measures. Most people who come to a screening are referred to a doctor's office for follow-up. You've got to connect the dots and get the data from the doctor's offices. So does that data exist? If it doesn't exist, how can we create a process to get it? Like, for example, asking an extra question that says, what lifestyle changes have you made? Or have you made any based on the education program that you went to? And in some cases, that data already exists. We just have to get it out in some useful fashion. Sometimes it means starting at the top to get the blessing of the most senior administrator or the CIO to put the right IT professionals on your team and have them help you. I've talked a lot in webinars that we've done about IT professionals that we've worked with who were the people that understood the databases, that were able to take what was a text field in the nurse's notes and make it a queryable data field so that at the end of the year we can look at the percentage of patients who reported that they had distress on a cancer distress tool as part of the cancer care. And then we can look at the number of people who had a mammogram, let's say a clinical breast exam. We gave them a voucher for a mammogram. How many of those people actually showed up for the mammogram? And did we follow up with those people that didn't show up if they didn't? So the folks that understand the patient registration databases can actually help you either get that data out in a report. They can, if the report doesn't exist, they can give you print screens of the data so you can start to tabulate it. But generally speaking, if you have an informatics department in your organization, there's somebody who knows how to do that. And if your organization isn't big enough to have informatics experts, you might have somebody in medical records. I've worked with medical records folks who are excellent at querying the data from their medical records to be able to give you the outcomes information that you need. So find out who the person is who's most knowledgeable about it. Then you want to determine, well, what are those data elements that you want to track, measure, or report, and do they exist anywhere? And ask the IT professional to understand the work process flow of what you're doing, okay? If they really understand what it is that you're trying to accomplish out of your program and the data that you might want to collect, they might actually suggest to you other variables that you would want to collect as part of your outcomes measures. You want to determine if your current software has standard reports that can be customized or if new reports need to be created. Most informatics folks that I know will say, well, yeah, we can get that, but we can't get that. But if you give me 3 weeks, I might be able to develop that report. Or we might have to go out to our vendor and ask them to create a customized report for us for this data, but it can be done. And then determine if they can do it themselves internally or if the vendor has to be contacted. But we've worked with folks in kind of all scenarios that have had to do it various ways, but it can be done. And then you want to create reports from your data. And I'm going to talk a little bit about a case study, which is St. Vincent's Hospital that's part of the Allegheny Health Network that's actually here in Erie, Pennsylvania. We did their community health needs assessment implementation strategy in 2015. So you're seeing some of the outcomes of that work a few years ago. And they've given us permission to sort of share this story. But what's interesting about it is that they have developed a pretty sophisticated tracking system for their diabetes management tracking, because they have a accountable care organization, and they're very interested in population management, and they're focusing on diabetes as one of their key implementation strategies. Now, when they started this process, the reports were typically data dumps from system databases to spreadsheets. They were built in extraction from applications, and only the most savvy Excel users could use those spreadsheets to analyze information. Most of the reports were ignored. Data was rarely analyzed. People weren't using it. The data existed, but people weren't using it. And the medical director realized that the hospital was losing out on reimbursement programs from insurance companies. Like, real concrete example, Highmark, which is one of the big payers in this area, was giving incentives for doing some of this follow-up stuff, and the medical director realized that they weren't capitalizing on that. They weren't taking advantage of that potential revenue and to improve patient care. They also recognized that there was a wealth of information in that database if they could use it. And senior leadership needed to understand that return on investment. It's like, why would I take my IT resources off of this and put it there? Even if hospitals or health systems have informatics people, most of the folks that I know are really busy, and they don't have, 15 extra hours to help with this stuff. How do I get their resources focused on what I need to have done? Now, what they did was that an informatics specialist developed multiple reports that helped providers understand their populations and help patients understand their health and progress toward their goals. And they created this series of dashboard reports. And one of the other resources that you're going to get after this webinar is all of the various reports that were created so that you could look and say, hey, look at what other people can do. Can we create something like this? And in this particular situation, it increased primary care reimbursement $12 per visit in their owned primary care practices, which over time generated quite a bit of revenue. So here's a good example, because what this was the diabetic patient appointment information sheet. So this was information that took their testing data and coupled it with their results and actually tracked it over time so that the patients can see, the doctors could prepare for the patients, and the patients can see how their values were either going up or down over time. This same concept can be used to say, am I screening a patient and then am I tracking them over time? And there were longitudinal blood pressure tracking so that the patient's blood pressure could also be tracked over time, as well as their weight and body mass index. Other things that were tracked include on the population, they were looking at the number of patients that used tobacco, the number of patients that were smokers, were the percentage of people that were hitting some of their goals. So they were looking at individual patient outcomes, and they were also looking at population-based outcomes. And what did they learn? What did we learn from sort of looking at this case study? Is that connecting the CHNA efforts to the clinical practice and to the population-based health planning, connecting those dots really makes an impact, because it makes an impact in itself, because then people understand, well, why is tracking important and how can we get a return on investment? Identify a physician or clinician champion to drive the process, particularly one who's managing a particular patient population. I've talked about other examples in the webinars of other folks that we've worked with that are looking at achieving the 20 by 2018 American Cancer Society goal for screening for colorectal cancer, which is a big health priority in many areas. They got a physician practice to champion the use of FIT tests, which they're doing as part of their community benefit and implementation strategy because of their China. And that physician champion was able to get the screenings underway in their individual practice and encourage other physicians to follow suit. You want to look for the financial incentives available in the system, because like in this case, there was an incentive to actually really look at those diabetes management checks as part of the medical record. And in some cases, if you have an ACO or you're part of a value-based payment strategy, your incentive is actually cost reduction. So you have a financial incentive to do it. But try to make the case to get the extra IT investment into what you're doing, and then find the right IT professional skill set. You know, this particular informatics person that developed all of these reports learned the skill to do that from working at a pharmaceutical company and brought that into the hospital and was able to develop a lot of that reporting and tracking by pulling multiple databases together. Chances are, if you have an IT staff, somebody on your staff has some of those skills and can put them on your particular effort if you're interested. You want to look for specific skills. It's not just any IT professional, but the right one. You want to find somebody who has the ability to write queries to extract information from relational databases. Because one of the big frustrations I hear from clinicians and from administrators often is, well, the data may be there, but we can't get it out. Or we're not tracking that now, but we can't get the behavior change to track it. How do we do that? And then the writing of reports from applications such as Crystal Reports or Excel, those graphical workbooks or the Excel pivot tables. Those are the kind of skill sets that are able to do this kind of work. And then some more general skills, but the ability to elicit requirements from users, providers, executives, office staff to understand what they really need. One of the things that we're doing with one of our client organizations is educating the lean team as well as the informatics nurses on how to think logic model, so that they're building the capacity of the internal staff that is working with clinicians on IT kinds of things and process improvement kind of things, how to really be on the lookout for putting the right outcomes measures into place. And the lean teams and the informatics persons are the ones that have the ability to do that. If they were equipped and understood the logic model process and knew more about some of the intervention strategies that we're attempting to do in our hospitals or organizations, we would be able to connect those dots better and build the capacity within our health systems to be able to measure and evaluate better. You want to create what I call an indicator automation action plan. And part of your packet that you'll get after this webinar is a template for an action plan as well as an example action plan, because it's what I have here in the example is impossible to read because it's tiny print, but we'll send you a copy of this as an example. You want to identify the outcomes and impact indicators associated with each of your implementation strategies. That's the logic model. Determine whether the indicator exists or if the data collection approach needs to be developed or automated. Like in some cases, we're tracking the number of people that we do clinical breast exams. We're tracking the number of people we give vouchers to. We may be tracking the number of people who show up for a mammogram, but we might not know what happens after that. Well, what percentage of the people are actually diagnosed with cancer, and do we follow them to an outcome? And are we able to, over time, decrease the percentage of stage 3 and 4 cancers that we find? Determine the work process flow or the change management implications of the data collection, and then incorporate this orchestration onto your to-do list. What the heck does that mean? Okay? That means that if you're asking your, let's say your screening nurses who are doing clinical breast exams, you're asking them to change their process so that they register, because we've had clients that have actually given laptops to the staff that does this so that they can actually register these patients so that they can be tracked for outcomes. That's a work process flow change for that clinical staff. Well, sometimes the barrier is they don't have a laptop, so we have to give them a laptop. Sometimes the barrier is they're not comfortable with the laptop. They would rather have that tick sheet on their desk. So helping them get comfortable with the new work process flow change and the expectations also has to be part of the work, which is why a lot of this process change is well suited to lean teams, because the facilitators that are doing quality improvement anyway are actually, they can actually build in the behavior changes that need to happen to collect the data better into the action plan. So you want to actually get the clinicians to know that, well, we don't want you to put that outcome as a text field in the nurse's notes. We want you to click on this new drop-down box. So now we can query the data and actually get a report of our outcomes. So some part of your action plan needs to talk to the people who are actually doing the work so that they can change their process to give you the data that you need out of it. And that's one of those implementation details that we don't think about, and why we don't necessarily have good data collection systems, because we have to, in many cases, change people's behaviors to collect the right data at the source. Or we need to actually create a report of the data to get it out of the source. But those activities need to be part of your action plan, or you'll never automate them. So how do you create that action plan? Look at each strategy. What are the measurable outcomes and impacts associated with the strategy? Is the data, is it automated now? And if it's not, who do I need to talk to? What needs to get done? And then repeat it with each of your implementation strategies. So when you're done, your action plan looks like this. And if you can't, I'm sure you can't read the fine print, but cancer program discharge patient distress ratings, okay, it might be one of my goals. I want to know that by the time people are discharged from our program, that they no longer have distress. We want to decrease our no-show rates for some of our programs, okay? So we can track that over time. So this worksheet actually gives you the ability to sort of look at, okay, what's the variables and data elements that I need to collect, then track. Is this data in the system today? If it doesn't exist, how do we create it? And then what needs to be done to capture that variable? So if you just work through each question, that'll give you a way to start to begin to automate it. And then you can say, okay, now if I'm going to get this in place, what are the action steps I need to put in place? Now I can assign, determine the point in time which staff members are best suited to administer a post-patient distress tool rating. Okay, you can assign somebody to do that. Talk to clinical supervisors about the importance of administering that tool. That somebody can do that. So you can actually break those activities down into the specific things that someone needs to do in order to get your indicator data collected and get it tracked and get it reported. Okay? Determine if a variable to query or report no-shows exists in the Women's Health Center registration database. I would assign that to my IT staff member, and I would put a time frame on it. So the more granular you get, the more likely you are to be able to orchestrate that difference and to create the kind of reports that I showed you examples of earlier. So, what does this tell us about what we need to do? Think about this as your takeaways. Determine your understanding of how patients flow through your continuum related to your CHNA priorities. What is it that you're ultimately trying to impact, and how do they flow through your system? Look at the output, outcome, and impact measures using a logic model format, okay? The ultimate impact of, whether or not I do a lot, good breast screenings and get people to come into mammograms is that I'm diagnosing early stage cancer. Those are the kinds of outputs I want and outcomes that I'm looking for. Talk to your IT professionals about how the data can be collected and reported. Determine what currently can and can't be measured, and then develop an action plan. That's that gap analysis. Determine an action plan to collect and automate the data and reporting and incorporate it into your CHNA implementation strategy and action plan so that you're tracking those elements as well as the programs themselves. Because what we've found in working with lots of people in lots of places on implementation strategies is clinicians are so focused on taking care of the patient, on doing the program, on creating the outcome for each individual person, we really don't take the opportunity to step back and say, how do I know that this whole program is being effective and efficient and getting me the outcomes that we want? We have to create a process to tell us whether that's happening by identifying the right variables and putting a plan into place to measure the data and then report on it when we're done. I hope that is helpful in terms of giving you an overview of the process of preparing for and implementing and automating your outcomes and impact measurements. But as I said in the beginning, the real key to success is really partnering with the IT professionals who have the ability and the understanding to do the things that you want to accomplish. So with that, I will ask if there's any additional questions that anyone would like to ask. I do have one question that I received via chat earlier in the presentation that I'll go over now. And one of the questions was, how do I get the attention of senior leadership to make this a priority? And one of the things that we don't think about, so in answer to that question, I'm going to recall back, I did a training program with Dr. Bob Motley, who is the head of population health from Lehigh Valley Health Network not too long ago here in Western Pennsylvania. And part of what he talked about in that presentation was the role of the community health needs assessment professional as an influencer and a change management facilitator when they don't have the authority in their role in a health system. And I was fascinated by that because, and the point that he was making was talking about the fact that sometimes we need to educate people about the importance of changing the things that we're doing because there's a benefit to all of us. And recognizing what the benefits are and talking to people about what their interests are and starting to influence people's thinking by understanding their interest and having them understand your interest, you can start to build momentum around, well, gee, this thing seems to make sense. And if you're able to collect some data or make a case that there is a potential return on investment that can be quantified by putting additional resources on this effort, whatever it is, like the diabetes management process I identified earlier as an example, or, you name it. There is some potential, what's in it for me, for the health system, potentially to put resources on it. Start to think through what that is, and then start to make the case to the leadership team that this is worth doing because it relates to our corporate strategy. It relates to our readmission strategy. It relates to our population health strategy. So it's not just the program we're offering, but there's a much broader context and there's more important impacts that we ought to look at related to these strategies. Any other questions? Okay, hearing none, I'm going to stop our recording for today. And thank you all for listening in on the live recording, or if you're listening to the recorded version. If you have any questions after the fact, you can send them to me via email or send them to Kathy, my colleague, who will be sending you out the information. We'd be happy to talk with you specifically about what your information and or intervention needs might be. And we hope you have a wonderful day and good success in taking your organization to the next level.